Doctor, I had a checkup because I can't hear well and my ear feels blocked. And I found out I have something called stiffness in the stapes bone. What is this about? What is this disease? What does it do? And how do we treat it? Stiffness of the stapes bone is a disease with an unknown cause. It occurs more often in women than in men, usually between the ages of 20 and 40. This is increased by pregnancy, and the hormones that are released during pregnancy, it can occur in children and it can occur in adults. But this is the most common age for it to appear middle age. That is, at the time when a woman is giving birth and having children, this is the time when it is most likely to happen, right? Yes, she hears well, her ear feels blocked, and there are no other problems. Her ear doesn't discharge pus, nor is there any problem other than that she can't hear well. This issue starts in one ear, and then the other ear might be affected over time. So how do we diagnose it? When we examine, the checkup comes out normal, nothing appears. We do something called a hearing test. This hearing test reveals that there is a problem with sound conduction. The conduction of sound to the inner ear usually doesn't involve a problem with the nerve, except in some cases. As a result of this condition, but in most cases, the problem is with the conduction. This conduction happens when sound enters our ears through the ear canal, reaches the eardrum, and makes it vibrate. This vibration is then transmitted by three small bones. These three bones transmit the vibrations and amplify them so they reach the inner ear, which is filled with fluid and contains sensory receptors that send nerve signals through the auditory nerve to the brain. For us to hear, what happens is that if there's a problem with one of these bones and it doesn't move properly, when that bone doesn't move well, the sound doesn't get transmitted properly. What's the cause? Sometimes there's no clear reason. We still don't know exactly what's happening. All right, we've diagnosed the problem. So how are we going to treat it? Look, there are two things we can do. The first option is to use a hearing aid. This device amplifies the sound, which helps that bone move. That bone doesn't move 100%. It moves, but not like it should normally. If we make the sound a bit louder, we might be able to hear well. But what if I don't want to wear a hearing aid and want to hear without one? What should I do? There's a surgery where we remove the bone that doesn't move, and in its place, we install a device as a substitute for that bone, fixing it onto the other healthy bone so it can transmit sound to the inner ear. So is this surgery difficult? No, it's not difficult. Are there complications? Honestly, yes, there are some complications. But its main issue is that it's not suitable for everyone. For example, people whose jobs require a lot of physical effort, those who do intense manual labor, those who lift heavy objects like weightlifters. These people shouldn't undergo this surgery. Using a hearing aid is actually better for you. Also, those who fly airplanes like pilots, airline captains, flight attendants, or people who travel frequently, there's a risk when they're constantly ascending and descending in airplanes because of the air pressure. Because the device we've implanted could leak, move, or cause a problem. So we don't recommend this surgery for these people. We recommend a hearing aid instead. What other issues can the surgery have? Honestly, in a small percentage of cases, it can lead to hearing loss. That's because we're performing this surgery near the inner ear area, which is very sensitive, so the nerve might not function properly. At that point, our only options are to use a hearing aid or to get a cochlear implant. Don't be afraid of the surgery. We perform it for specific people and it gives good results. But the choice must be discussed thoroughly with your doctor. Should use a hearing aid or have surgery? Wishing you a speedy and complete recovery. If you enjoyed these videos, please like the video and subscribe to the channel so you can receive more of them. Wishing you all the best.